Okay, hello everybody. Thank you for coming today. If you can hear me, up the top you'll see there is a little person. If you could put your hand up just to say, yes, I can hear you. And welcome, Kathy and Adrian. So you just go up and raise your hand up the top there. Excellent, Kathy. Okay, Kathy, you can pop your hand down now. How about yourself, Adrian? Okay, great. Excellent. All right, so let's get started. So the purpose of today's tutorial is to go over the medical terminology unit. Now, you may have had a look at it already, but I'll just be going over basically looking at your unit assessment guide, going over the instructions of what you need to do. It is quite a big unit and there is 3 assessment tasks to complete this assessment, this unit. So we'll go into that first. You'll notice here I'm going down, I'm in Moodle, I'm actually under Certificate 3 Allied Health. But they're all very similar. So we're going to go into communication relationship. Now, scrolling down, you'll notice here your unit assessment guide. So as I've actually said before, your unit assessment guide is basically the Bible of knowing exactly how to complete your assessments to make sure you complete the course, to make sure you complete the unit. We'll give you a full guide there. So we'll open up our unit assessment guide for this unit. Okay. So you'll notice here it will give you the unit purpose. And then the unit purpose is to demonstrate your skills and knowledge required to understand and respond to instructions, carry out routine tasks, and communicate with a range of internal and external clients in a medical environment, as well as use appropriate medical terminology. Now, as allied health assistants, we'll be using medical documents, we'll be reading client details, following instructions either from a physio, occupational therapist, could be a podiatrist, depending on the course you're doing. So if you're Certificate 3 Allied Health, you might have a range of practitioners, whereas if you're Certificate 4 in physio, you will have that one person who will be giving you instruction. Also, though, you will be reading notes. So can somebody write in the chat pod here what client notes you could be reading? So if they come from a GP, so your general practitioner, what kind of document would you be reading where you'll find medical terminology? Yeah, referral, pathology form, yeah, specialist report. So there's quite a few different documents where you'll come across medical terminology. So this actual unit will go into a little bit more detail of how to understand that medical terminology. Okay, so let's review down. So it's asking you the assessment plan is to complete assessment event 1, which is a portfolio based on medical terminology. Assessment event 2 is based on communicating with medical terminology. And assessment event 3 is your short answer questions, medical practice procedures. So we'll keep scrolling down. The conditions here just outline basically how to submit your assessment, make sure you put your name. It's very important you put your name on all your assessments. There's quite a few assessment tasks you need to upload for this unit as well. It's very specific. So we'll go down. Okay, now our first assessment event is based on a portfolio. So this event requires you to submit 2 presentations that demonstrate your ability to interpret and understand medical terminology. Just one moment, we've just got an extra person entering. Hi Raquel. Please type in the chat pod if you can hear me. Mm. Okay, we'll just keep moving on. Raquel, if you can hear me, if you can put your hand up the top on the corner, you'll actually notice a little person. If you put your hand up, I'll just make sure that you can hear me before I move on, or write in the chat pod if you can hear me right now. Okay, so we're moving on. You'll notice here, so we need to make sure that you can understand medical terminology and communicate orally with fellow health workers because you will be working in a health industry. So whether it's in a hospital, a GP super clinic, anywhere you go, you're going to come across medical terminology. So we need to make sure that you can either understand it and also communicate. All right, so we're going to have a look here. It's going to ask for this assessment, it's based on scenario 1. So I'm going to open up that scenario. Okay, and then we'll go back to your unit assessment guide once I've gone through the scenario. So the assessment about 1, scenario 1. You have recently been employed at Indigo. So you may have come across Indigo already. So if you've been to a foundation workshop, we go over Indigo and you act out in scenarios as being part of Indigo. And you're working there and you're employed by Dr. Kelly, and she works in Indigo is a super clinic. Indigo Community Services and Health Hub is a medical practice that deals holistically with health concerns while offering a range of health options from both modern medicine and evidence-based complementary treatments. So Dr. Kelly is a general practitioner at Indigo, and part of her team, Dr. Kelly's approached you and asked for your assistance in preparing a presentation and progress notes that she would like you to distribute to the staff at Indigo to assist them with their medical terminology. Okay, so your task here is to prepare a presentation and complete progress notes. Now, if you scroll down, you'll notice here the presentation. Dr. Kelly has provided you with medical terminology presentation she's commenced, which you can access here. So if you click on this little icon here and asks you to complete the following. So I'll open up the medical terminology. You can have a look at that, and then I'll just go back over our scenario. It won't be a moment. Okay. So you'll notice here that Dr. Kelly has already started it for you. Now, part of the task, so this is basically the template and you'll need to complete it. So we'll go back to the instructions. So for the 5 slides that contain human images, identify the name of the system. So if we go back to our slide, and you can already see here, they've identified the skeletal system. And they identify 2 root words for the system. So you've got 2 root words you'll need to write down for each system. So for here, the 2 root words for the skeletal system are ARF and osteo. Can anybody tell me what ARF could be short for? Okay, just wait for Adrian to type in his answer here. Yep, perfect. Arthritis, arthroscopic, perfect. Okay, and then we're going to look at your so identify 2 root words and use the root words as a prefix. Identify an appropriate suffix to combine with each root word for the system. So we go back, we'll have a look here. So we've got itis, so arthritis. It's very common in the elderly. Osteoporosis. So see how the words are combining and creating that suffix there. Okay, we'll go back to our instructions. Name and describe 2 other complete medical terms appropriate for the system. So we've got our skeletal system, and you need to put in 2 other words. Oops, sorry. Scroll through there. So, yep, like Adrian mentioned before, arthroscopy. So it's a visual examination of the joint, and osteotomy, incision of the bone. So it's quite a few different terms you might come across, but we only want 2 terms for the system. So you've got your skeletal system, and you'll need to move through each. As you go down, you'll have different words for each system notified and listed here. Okay, we'll go back to our instructions. And then it's also asking you to name 2 parts of the anatomy included in this system appropriate to Dr. Kelly's practice. So we'll go back to our PowerPoint. So the tarsal and the patella. So that is the skeletal system completed. So you'll need to go through now and have a look at this system. Can anybody mention which system this might be? So you've got the heart, the veins. Very good, Kathy. Yeah, very good. And so we need to now go through. So very similar to what Dr. Kelly's done over here. You'll now need to go through and name 2 root words for the cardiovascular system and moving forward, going over each one as you come down and down here. It's also asking you where did you find your information? So there is a learner guide. I'll go to that in just a moment. However, you also want to provide the staff somewhere else if they want to clarify medical terminology. So we would like you to list 3 different sources, whether they're on the internet or whether you know of a good book. You can just pop them in here on medical terminology. So that's part of your assessment task there to complete that as well. So we'll go back to Dr. Kelly's instructions. So Dr. Kelly tells you that she's completed the first one for an example. Your task is to complete the information for the remaining slides. So we've gone over that. On the sources of information slide, identify 3 sources of information. So we've discussed that. To ensure staff are correctly pronouncing the medical terms, Dr. Kelly would like you to record your presentation, including your voice clearly pronouncing the information on each slide. So basically what we would like you to do is use the features in PowerPoint. Get used to using the features. You could go into a place like Indigo and then you may be asked to present to the other staff members. So what you'll need to do, when you go to insert up the top, so you can see where I'm up the top here. Can everybody see that? Yes, perfect. Okay, everyone's following along. So we'll go right down the back, right down the bottom here. Now here is an audio bar. So when I click on the little icon, the little arrow here, so you can upload. So I could go here and upload if I've recorded on my phone. So you can record going over each slide on your phone, and then you could send it to your computer or send it to your email, save it to your computer, and you can go through your files and find it. Or you can actually click on here and press record audio. And then start going over each presentation, recording your own voice for each presentation. So the information, some people get quite funny about this, but it's really just all you need to know is yes, you can pronounce the medical terminology going over each word and just filming, listening, recording your voice. And like I said, you can do it on your phone or you can record it through your computer system. And that is part 1 of assessment task 1. So you complete your presentation and then record, saying each system, the root words for each system, going over medical terms, and also listing anatomy for that assessment task. Now, if we go back, you'll also see, so it's basically what I've just shown you then, how to record your voice is in video here. So it's also, there's instructions in here. So you can open that up and it will give you some instructions on how to do it. So it's just basically demonstrating what I've just showed you. And it will also save in your PowerPoint. So basically what it will look like, it will come up with a speaker over here. And I can just click on that and I'll be able to listen. Your assessor will be able to listen to you basically going over the whole presentation. So we want to hear you going over the whole presentation there. Okay. Well, let's go back to our UAG. lost it. Won't be a second. Let's open that back up. And okay. Any questions on that PowerPoint or the PowerPoint presentation? Do you have any questions before I move on to the next part of this assessment task? Okay, no questions? All right, moving into the progress notes. So Dr. Kelly's provided you an example of how to write progress notes for a patient, Betty Smith, on slide 2 of this progress note presentation. So we'll open that up. So if you just press on the control and then click on where it's highlighted, you'll be able to open it up. It'll come down the bottom there. So it's very important you're using Google Chrome when you're opening up all the documents as well. Okay, so this is a staff presentation progress notes. We'd like you to put your name in here and then go into the slide. So you'll notice here that Betty Smith, so I'll go back to the instructions, it makes it a little bit more easier to understand. Okay, so Dr. Kelly would like you to rewrite the progress notes for Muhammad Islam. Muhammad's details are on the slide 3. Upon completion of the medical terminology presentation and progress notes, Dr. Kelly is asked you to submit them to her for final approval before sending them out to the staff at Indigo. So basically that's the end of that assessment. You'll upload your assessment task to us. Now going back to your progress notes here. Okay, so you'll notice here that Betty Smith, 56 years, is admitted with a diagnosis of chronic airways limitation. So you'll notice down the bottom, CAL is chronic airways limitation. Betty presents short of breath, SOB, and is ordered oxygen via a mask. Betty is commenced on intravenous fluids and is to have the nebulizer 3 times a day. So you'll notice here, it's been shortened. Have the nebulizer 3 times a day. So the doctor, so DR, ordered deep breathing and coughing to commence 4 times a day and monitoring of temperature, pulse, and respiration 4 hourly. So you'll notice here it's all been put into medical abbreviations. So you move into our terms here. So what Dr. Kelly would like you to do now is to go through and simplify. So looking at putting in terms. So she's done up here with Betty, and your task is now to go through and put all the medical terminology down the bottom. So you'll review myocardial implication. So basically now you'll need to go to your learner guide and you'll be able to find where to find the abbreviation for that medical term. Okay, and you also need to, you don't need to record that. So your progress notes you don't need to record, but your presentation you do. So to find your, to find learning information, you will need to go scrolling down, back into Moodle, and here's your learner guide. And here you will find what is medical terminology. Scroll down, give you all the information you need to answer both your presentation as well as your progress notes. So if you keep scrolling down, you'll get some definitions of medical and nursing terms. And here is inner body. So if you go onto this website, it's actually really helpful just with identifying the human anatomy. So if you have a look in here, so if you click on here, and here is all the information you need to answer your PowerPoints. So we identified, we had the cardiovascular system. So here it is over here. You can click in there and you'll be able to find all the information you need. Oh, refuse to connect. Okay. Oh, here it is down the below. Okay. So you can start going over the cardiovascular system. Okay. And once you've completed that task, you can go back here, open up your learner guide, and you'll notice up the top here it has home, section 1, Section 2. So here we'll give you some verbal communication. So you would have actually gone over a lot of verbal communication and non-verbal communication in your communication unit. And so that's all backing up. So referral letters. At the foundation workshop, we went over referral letters, completing forms and checklists, progress notes. So it's all there, and you've already had experience with that. Some ideas of what patient identification checklists are. Can you give me an example of a checklist that you'd find in a medical practice or in a hospital even? Anybody? So medical history form. Kathy, you're doing the pathology, so you'd have a pathology form as well. Could be a referral letter that has on there exactly what needs to be, what kind of it could have for blood tests. It could have a list of what needs to be tested for the patient, what kind of disease they're looking for, or illness. So that's definitely a checklist that you could use in the pathology collection area. So you start going through all the information here. So it's how to make sure you're detailing, make sure you're putting all your information for progress notes, signing off, putting the date. So we'll move into that in just a moment. Section 3. So also here we are. So examples of medical terms. So this is what you'll need. This is the information you're going to need when you come to looking at the medical terms, abbreviations. So looking at abbreviations here. So it's in section 3. You'll be able to go back and start looking at, okay, how can I abbreviate myocardio infarction? So you need to put that on here. Okay. Now we'll go back to our assessment task. Okay. So that's all we'll need for assessment event 1. So basically doing a full presentation of your medical terminology and completing the progress notes. That's what we need you to upload. And if you've actually recorded your assessment via your phone, you might have a different file, or it's best if you can add it into your PowerPoint. So once again, I'll just show you where to go for that. It's always up to, normally it's on home. You'll need to go to insert and all the way across to audio and record audio, whether you want to do it on your computer or whether you would like to do it on your phone and add it onto your computer and insert it as a file. So you could just go into just basically going into a file and then uploading a file. Your recording in there. Okay. Any questions on assessment event 1 before I move on to assessment event 2? All good? Excellent. Adrian, do you have any questions at all? Raquel? No? Excellent. So there isn't a due date for this assessment. So it's basically start any time. We do suggest you do it when you're completing the communication unit, which everyone's pretty much passed now anyway, which is fine. It's just one of the units that needs to be done before you complete your assessment, before you complete the course, sorry. So you'll notice there's quite a few that are sitting in that you complete any time because it is an online course. There isn't an actual practical component to this as such. The practical really is only the recording. So there isn't a workshop based on it. There isn't a practical that you need to do. So it can be completed even if you left it to the last assessment. However, we do try and get you to do it when you're looking around, communication, it's all part of it when you're going into anatomy. So it's all very similar. So if you're in the same topic, it's best to just go, okay, well, I'm going to complete that assessment at the same time. And same with your customer service. It's very much matched up with communication. And then you've got your diversity also falls into communication. So it's good just to add the others that are sitting there, start any time when you're completing another assessment, but no specific due date. Okay, that's assessment event 1. Now let's have a look at number 2. Close that learner guide. And, okay. All right. Assessment event 2 is a portfolio communicating medical terminology. So this event requires you to submit a portfolio of evidence that demonstrates your ability to interpret and use medical terminology to communicate with patients and fellow health professionals. The assessment for this event is based on scenario 2. So I'll open up in just a moment. Your portfolio of evidence must include the following items. So oral communication with the client, a letter to the client, and a referral letter. So we'll open up scenario 2, then we'll come back to our criteria. Okay. All right, so you'll notice here, assessment event 2 is scenario 2. Dr. Kelly was very impressed with your presentation and has received excellent feedback from the practice management and administration staff at Indigo Community Services and Health Hub. Dr. Kelly has left your recorded message here about a client she would like you to telephone regarding upcoming appointment. She also wants you to write a letter to the client confirming the appointment date and time. Dr. Kelly has provided you with further instructions below. Before you call the client, Dr. Kelly would like to hear what you would say and has asked that you verbally record what you would say to the client so that she can listen to it prior to you making the call. Dr. Kelly provides you with the following information. For the recording, it's important that I can hear you clearly pronounce what you are saying. To undertake the recording, you may wish to use. So once again, going back to our smartphone. If you can record, if you have a phone that you can record on, perfect. You might have to record on your computer. So there is a software that records your voice, such as Adobe Audition. So you can download them on your computer. Indigo's letterhead, which you will need for the letter to the client, can be accessed here. So what Dr. Kelly, so you need to open up the voice recording from Dr. Kelly, and you'll also need to open up the letterhead. So here is what the letterhead looks like. So you need to enter the date, enter the title, Mr. and Mrs. So we know it's, just go back to our recording, our voice recording here. Yeah. So I'll just play this for a moment. Okay. So we could hear that Mrs. Green is our patient, so we need to make sure we're notifying Mrs. Green. Sorry, it just keeps cutting out there. Won't be a second. I'll just open it up. And you'll need to put all the information from the recording into the letter provided here. So once you've put all the information in here, you'll need to record your voice, and that is assessment event 1. So the letter, assessment event 2, sorry, the letter, the voice recording so far. Any questions on that? Was it all very straightforward at this stage? Okay, no questions? All right, so I'll move on. Go back to our scenario. Okay. So you just need to complete the letter based on what Dr. Kelly has actually recorded here for Mrs. Green. The next part of assessment event 2 is to complete a referral letter. So Dr. Kelly has left you the below handwritten referral letter to Dr. Butcher, which usually asks you to type up on the Indigo Community Services Health Hub letterhead. So once again, if you open that up, we'll provide you with a letterhead. Here it is here. Okay. And when typing the document, Dr. Kelly has asked that you convert any of the abbreviations, acronyms to full words terms. So we'll go down. So basically, it's taking all the information that's listed here, copying it over, and once again going back to your learner guide and providing the full term. So PT is patient and HX history. So we need to make sure that we're putting full terms in case the client or Mrs. Pink, if Mrs. Pink was reading the referral, should be able to understand it. Otherwise, she's looking at it now going, oh, what does that even mean? I don't even know what CXR means. So we need to make sure that we're going over our learner guide, providing all the detailed information for that assessment task. So assessment event 2 is based on a letterhead. So you'll need to complete the letter from the information that Dr. Kelly has recorded for you. So you can click on the recorded message here and you can listen through, take some notes, make sure you're writing notes as you go and filling all the information to Mrs. Green so she knows of her appointment at the hospital. And it's very important that we put in there, she must remain nil by mouth. And referral letter. So referral letter, all we'd like you to do is open up the letterhead, use the information, once I was saying before, copy it over, and then start looking at your learner guide and getting the information, putting the full term for that abbreviation, so NKA. So you need to make sure you know exactly what each medical term means. So we'll go back to our learner guide. Oh, it's actually up here. And you'll be able to commonly used abbreviations. We have a whole list here. They're all through here. Okay, any questions regarding scenario 2, assessment task 2? Okay. Have you tried on your phone? Do it on the phone. Okay. What kind of phone do you have, if you don't mind me asking? Do you have an iPhone or a Samsung? iPhone. Okay. Okay, so if you go into your iPhone, if you search at the top, you should be able to put in there microphone. Okay. It's actually, I'll just find it for you, won't be a moment. There is an app you can download which is called Voice Recorder. Okay, so I'll just type it into the chat bar. Okay, so Voice Recorder Lite. Otherwise, there is, yes, so voice memos is also, normally it's listed in extras on the iPhone. So I'll just, so the extras tab. Okay, yeah, so once you get in there, you'll be able to set it up. Go to Once you start recording, then you press done. It will let you save it. For the Samsung, yeah, have a look at your apps. Have a look at your app store for Samsung. So they'll be going into Google. I'm sure they would definitely have a voice recording app. On the computer, you should be able to do it as well. Like I said, if you wanted to, you could go for the PowerPoint way. If that's the only way you can do it as well, that's fine. Especially for the letter, that's okay. I don't think in actual Word you'll be able to. Let's have a look. So, no. So I think the best way is to go into an app, record it that way, and save it to your computer, or send it via email to your email, save it to your computer, or send it straight to our email is another way. But it is always best to have all your assessment tasks together on Moodle, and that way you know where they are for future reference. Okay, let's have a look. Okay, so it's assessment event 2 completed. Let's move into assessment event 3. So assessment event 3 is basically just going over exactly what you've done for the whole assessment task. So it's a written task and it's based on short answer questions, and it would like you to, if you have a look here, I'll open up the template. Now you need to complete the cover sheet, so fill the cover sheet in like you would normally. And this event requires you to submit a written document that demonstrates your knowledge of medical practice procedures. So if you're working in a medical practice, the assessment for this event builds on the task completed in assessment event 2. Your written document must include the following item: medical practice procedures written task. This item must address the criteria listed in the below criteria, the marking criteria below. So the first one, identify who you would seek assistance from when undertaking the communications. So telephone call to client, letter to the client, referral letter in assessment event 2. It's basically asking you to address if you needed assistance, who has been part of helping you in the role. So with the scenarios, who has been the main person you would need to go to and confirm exactly your instructions, your workplace instructions. So if you didn't know what you needed to do, you've been given the scenario or the task and you weren't sure, who would you go to? Who would you clarify your job task with? Can somebody answer that question? So we've got Dr. Kelly. So Dr. Kelly is the person you need to clarify. So Dr. Kelly has been providing you with the task, so we need to clarify. If you're unsure, you'd make sure you seek identification and identify exactly what you need to do, because you'd like to do it right. You want to have all the information there. Question 2, identify who you would provide the referral letter you completed in assessment event 2 for authorization before you send it. So you need to make sure you're providing the letter to somebody before you send it out, just to double check, make sure all the terms are clearly, or the abbreviations are listed with all the proper terms, the correct terms. Outline 2 policies and procedures relevant to recording a client's progress notes. So that was back in our learner guide, and based on section 2, you'll read all the information here and the legal aspects to communicating and documenting progress notes. So what must we do when we're completing progress notes for a client in the health industry? Can anybody answer that question? So we're going to sign and date. Okay, going down. Just open that back up. Sorry, it might be a moment. Okay. And the last question here is explain when you could use a checklist in a medical practice. Provide one example of a checklist. So assessment event 3, you only need to answer the 4 questions identified here and submit that as well with all the other assessment tasks. Assessment event 1, 2, and 3 need to be submitted. Now, any questions related to BSBMED301? Yes. Yes, Kathy, it is a big unit. It's definitely, that's why I thought I'd better just get in there just to let you know, in case you're going to leave it to last, it's best just to start looking at it now, picking away as you go. It's more breaking it down. So if you start on assessment event 1, review the body systems, place all your information, record, complete the progress note, send it in, and the next 2 follow. Assessment event 3 is probably the easiest out of the lot, but yes, it is a big unit, definitely a big unit to look at. Great. So you've submitted number 1 already? Great. Excellent. And assessment event 2. So it's a lot of voice recording. I'm not sure if voice on PowerPoint. Okay, so we'll have a look at that for you. If not, we'll let you know. Excellent. Any other questions regarding the assessment? Yes, you can submit it partially. However, it is good to always submit it all together, just so you know, okay, well, I've completed that unit. I don't have to go back to it later. So if you submit assessment event 1, and then maybe in a month's time submit assessment event 2, your result isn't going to be finalised until you've submitted assessment event 1, 2, and 3. So it is good to try and get it all done at the same time, submit it all together, then you know, okay, I can move on from that unit because I've finished every assessment task required of me. And it's always good to make sure there is no resubmit required as well. And if there is, address it as soon as possible. Okay, excellent. All right, so I'm going to talk about work placement now. So work placement, if you've been to a foundation workshop, you're ready to start work placement. So at this stage, we are talking with quite a few of our stakeholders that we do business with who actually will take on work placement students, which is great. It's hard to come by, so I would have spoken about what I expect when you go to work placement is to make sure that you put in place exactly the agreed hours, times that you're available. Now, we've been speaking to a few people and they're saying work placement will start around the June, July. So basically, our our involvement is to set up that meeting between you and the employer. We also have information when you go into Moodle. So basically what we do is just make sure that, yes, the workplace is happy to take somebody on and when is that available. So I know the private hospital at the moment, they've had a few of our students go through and they've just said, okay, after July, we're ready to take some more. So what would happen from here, we would ask you to go into Moodle. So you'll see on my screen, let's just go into, obviously for pathology collection, it's different. But for the physio, let's just go into physio because we've got Adrian doing physio. We'll ask you to go into tile number 5, which is about your logbook and work placement. Okay, so you'll notice here your work placement logbook, so you don't need that yet. But you'll need your student's guide to work placement and your letter of introduction to the host employer. So with your student's guide to work placement, we'll open that up. So work placement overview gives you a guide of what is work placement. So work placement is where you'll gain exposure to the workplace environment. So what you're studying at the moment, you'll actually get workplace environment, make sure it's definitely what you would like to do. You get to assist skilled workers already who are working in the field. So you might work alongside, if you're doing physio assistant already in the industry, and you'll be able to mirror their skills. Develop and practice the skills identified in the units of competency. So use what you've been studying to really implement. Like, okay, I know that I've got the knowledge for that. Now I'm going to gain the skills. Be assessed in a real work environment over a period of time. So you'll notice with some of our assessments, they can be simulated, and that's why we run our workshops. So you can come along and you can do simulation. However, there is units listed where they must be completed in a workplace. And definitely, so for physio, you have two assessments, or 2 units, I should say, where you need to do 2 assessments for each unit. So it's 4 assessment tasks that you must do when you're working in the environment, that specialized physiotherapy assisting environment. Same with the pathology. So pathology, you've got quite a few more. So there's about 5. You will need to make sure that you're in that environment to really have that exposure and pick up the skills. Develop the capacity to reflect on your own work practice. So you would have noticed if you've been to a foundation workshop, we ask you to sit down and reflect on how your appointment went with the client. What did you find that you would do differently? What happened that you didn't expect to happen? So we ask you to do this when you're actually in work placement. Why do I need to complete work placement? So training packages for the vocational education and training sector have been developed by industry experts. So industry experts, so whether you're, let's just go back with physio, there would have been a bunch of physios who came together and said, okay, well, I really want our assistants to get experience. So 120 hours, yep, let's go with that because it's suitable for the work practice. We want the students to have the experience before coming into the workforce and trying to gain more experience. They'll also say, I'd like the assistants to also study this, this, and this. You know, they must know about work health and safety. There's so much on work health and safety in the course because we would like the students to understand the risk involved with working in a physiotherapy clinic or a pathology clinic. The legal aspects. So they would like you to do a legal unit. Then you've got your very specific to physio, or if you're doing OT or pathology, this is what we'd like our students to know. And there may be some skills you think, oh, I'd really like to know about a certain other topic, but it's not listed in my course. But you will learn the skills on the job. So there's lots of different ways of learning as well. So who organises my work placement? So finding a suitable placement is the responsibility of the student. So we basically, like I was saying before, TAFE will help you in the suitability. We'll find, we've got the stakeholders, we do the conversation whether they're ready for a student, and then you as a student, you're required to arrange interview with the employer. So we'll say, okay, here is some details, please contact, they're awaiting for you to contact them. And still it's not set in concrete until you've been for your interview, and the workplace then chooses whether you actually fit into their workplace or whether it's not going to work out well, or your availability, you might not have much availability. So it really comes down to trying to make yourself available, putting together a resume. So you still need to have a resume, and you'll notice here when you go back into Moodle, we do ask you to complete the letter of introduction to the host employer. So I'll open that up so you can have a quick look at that as well. So everybody has access to completing this. So once we say, okay, you know, the private hospital here, this is a person you need to contact. So then you'll put the contact person's name in here. Sorry, in here. The date at the top, the contact position. So it could be the manager or the supervisor. And then you'll also put in the name. So we'll give you the information, and then you'll go off and put all this information in here, in the address. You'll need to put in the contact name in here, the host organization. Then we ask you here to choose an item. So whether you're doing Certificate 4 Allied Health Assistance, or whether you're doing Certificate 3 Allied Health, pathology collection, dental assisting, and Certificate 4. So there's quite a few you can choose from. So let's go with Certificate 4 Allied Health. And then you'll say, I need to complete 120 hours. So you just need to find the hours. So pathology, 35. 250 for dental assisting. So there's quite a few hours for the dental course, or 120 for the Certificate 4. So you notice you can match up the code. If you're not sure of the code, you can have a look up here and you can match it down here. So if we're going to do pathology collection, I would just change it over here. The code matches with the code here. I'll give you a bit of information here about where you need experience. So providing assistance to an allied health professional, clinical, medical, or surgery preparation routines, infection control, workplace health and safety procedures, reception duties. So you may need to do some reception duties. You might need to patient admission, discharge. You might need to do a health screening on a patient. So all this information is listed. So when you get into the workplace, they know, okay, this is what it's required of the student. And then we just ask you again, put the host information in here and scroll down, and then you'll have your name, your email, and your student mobile number, or your mobile number, going straight to your personal mobile. And once you've been for that initial interview and the workplace say, yes, I'm happy for you to start, and that's when you'll need to complete your agreement. So you'll go back to your student guide to Workplacement. So we've gone over our hours. Everyone aware of their hours, of how many hours they need to do to complete Workplacement? Yeah, excellent. So am I ready for Workplacement? So have you completed the following task? Assessment Event 1 of Communication. Assessment Event 2. Completing Assessment 2 means you've been to a foundation workshop. You've come along and you've participated and completed the practical component of each of the following units. Do you have your first aid certificate? If you don't have one, you need to organise with TAFE of when the dates the next workshop is running, the first aid course, so you can get involved. Let's get started. So first one is to investigate. So if you know of somewhere where you'd like to go, or you might have connections with a physiotherapist or an occupational therapist, depending on the course you're doing, you can put all the information. You can actually say, okay, well, I want to go to this physio clinic. This is the professional's name. Here are the contact details. And then you send that on to us. Making contact. So once again, you'll make sure you have your letter of introduction and the workplace host booklet. So that's going back into Moodle. It's listed here. So you'll be able to find that here. However, if we do contact you and say this workplace is waiting for you to contact them, they would normally already have that workplace host information. So you don't have to worry about that too much. The big one is the letter of introduction plus having your resume ready to go. And we've got that listed here, updated resume. So remember to use your communication skills during the interview to showcase your ability to work effectively with their clients. So make sure you dress to impress, so demonstrate your industry awareness. You should ensure you dress appropriately when meeting with a potential host. For example, wearing footwear such as thongs can give the impression you may lack safety knowledge. So we need to make sure we're closed-in shoes, leather uppers, especially for pathology students because you're handling a lot of sharps. So you need to make sure you are wearing covered footwear, especially when you go for your interview. So they are aware that, okay, we don't need to educate this person. They're dressed in appropriate wear, they've got appropriate footwear, and they're fine to go. Ask questions. So when initiating the work placement, the student needs to ensure that the clinic and or allied health professional can provide access to the activities and resources required in your training. So if we've actually given you a place where to go, normally we've actually discussed that. We've said this is what they need to do. Do you complete this, this, and this certain task in your workplace? Yes or no, really? Comes down to call on us for support. So if you're finding that you're not finding any workplace host or you're unable to get the work placement, please come to us. Or if your workplace has a question, you start workplace and they want to know some information and you're not too sure, please refer back to us. Sorry, Ricole's asked a question. Yes, that's right. So for Pathology North, they are located in Kempsey, but I will check if they're here in Port. I'm pretty sure they are coming to Port, or they will be opening up in Port. So we'll just double check that for you. But if you have a chat to teacher Lisa, so I'll put you in contact with Lisa, and we'll work out exactly where you'll be completing your work placement. If you prefer Port, we can definitely let her know that. But at this stage, it will be Kempsey, and it always has been from enrolment, unfortunately, at this stage. But I'll double check with her for you. Okay, so make the agreement. So what we'd like you to do, if you scroll down, here is your work placement approval form. So we'll have all your details in here, the employer details, the agreement. So if you decide, okay, well, I can do Monday, Tuesdays, and it could be 8:30 to 4:30. The start date will be here, proposed finish date is here, and you'll be doing placement just Monday, Tuesdays throughout that whole time, and to make sure you do calculate it up to 120 hours. If you shortfall of even 20 hours, you then need to find another work placement and go through the whole process again. So we need to make sure that we're adding up to 120 hours and the workplace are happy, they agree, and they'll sign down the bottom here. And agreed activities to be undertaken, so it's basically completing your logbook, which will be your work placement book, which looks like this. So your logbooks, every day that you go to the workplace, it could be for 8 hours, it could be 4 hours. And all we ask is you complete a description of the task. So whether it was assisting with an exercise program, it could be training in assisting an allied health professional. It could be observing. So you need to put it in here, date, the hours. Do we choose hours or the place? So with pathology, you can choose your hours. Unfortunately, you cannot choose the place at this stage. So Pathology North in Kempsey is the only place at this stage you'll be able to complete your pathology work placement, I'm sorry. So you'll complete whether you, like I said, you can negotiate with Lisa whether there's only two days a week, or whether you'll complete a full week, or whatever's going to work. And just only I can really, really make sure if when you do approve and say, yes, okay, I can justify allowing Monday, Tuesday out of my week to complete work placement for 35 hours, then please stick to it. That's all I ask. Please stick to when you make that agreement. So this agreement really is a contract between you and the employer to say, yes, this is what I can do. This is what I'll be there. Unless you're really sick, then we understand. TAFE approval, so then you'll send it back to me. I'll sign off and say, yes, I'm happy with that. I'll contact the employer just to introduce myself if I haven't spoken to them before, and just say, yes, how'd it go, and double check how your interview went, and clarify the specific hours and dates that you've set on your agreement. Then we ask you to complete a work placement safety checklist. So it's basically going into the workplace, make sure you do have a safety induction. The hours, daily hours and times a student will be expected to work. So some places might say, oh, look, we only need you to come in for 5 hours. Or some places might be 9. We need to know that. All the information we need to know. Is there emergency management? What happens if you suffer from an emergency? What's in place? If there's a fire, what do you do? Do you know what to do? No. You've just walked into this workplace, so you need to make sure somebody's giving you the emergency management plan. First aid, if you cut yourself, if you fall over, if you need to assist somebody else who's hurt themselves, what is the first aid procedure? What personal protective equipment wear are you meant to be wearing? What should you, before you go into the room to see the client? Hand washing, that's a big one. And then we're going to apply gloves. You might be required to apply a gown. You don't know until you get there. You might have to wear goggles. In dental clinic, you might have to wear a gown, goggles, mask, gloves. This is quite you need to know that. You need to know, okay, well, that's what I need to wear. So when you come in for your first day, before you see the client, you're going to hand wash, Put on your PPE. Who is going to complete the training, supervision, instruction? So who's going to be your main point of contact when you get to work, and who's going to sign off on your practical? Here is your logbook, your work placement logbook, but also your practical assessments for your specific units. What bullying and harassment, workplace violence, so what's in place to manage or minimize these risks. So if this happens to you, we do stress that you come and speak to us, come and let us know as well, but you'll also need to know exactly what the procedure is in your workplace. The risk management. So what risks are around you? What work health and safety risks? So at the foundation workshop, we do a risk assessment. It is assessment event 2 for your WHS unit. We would like you to review, look around you, what risk. In pathology, we've got sharps, dental sharps, needles. You need to be very careful. You need to know, okay, what's a risk and what can you do to control it. If there is an incident or injury, you need to notify us as soon as possible. And the host employer will sign off. And this is for myself to sign off here. If you're traveling, so you might be working at a workplace where they may do home visits, you will need to complete the vehicle travel with host employer supervisor form here. And you'll go down, and the last one is just to let the host employer know that you are covered by TAFE insurance. So if there is any problems or you do fall over, that's why you need to make sure you're reporting. You need to give all this information to us so we know you're in a safe environment for insurance purposes, plus duty of care from our point of view as well. Okay, any questions regarding work placement? So I know everyone would like to get out there and start work placement. So it's a bit of a process. We're actually putting together a list now of who we can provide work placement, what clinics are out there ready to take on students. I know with pathology, the teacher is actually sorting through, putting together a schedule of availability throughout the year. So that's all under control. Adrian, do you have any questions? No? Okay, great. All right, so that's the end of the webinar. We've just gone a little bit over time, but that's okay. So if anyone got any other questions regarding BSBMED 301 or work placement at this stage? If not, that'll be the end for today. If you have any questions throughout the week, please email through and we'll be able to respond to you. Excellent. Thank you very much for coming. I appreciate it. Have a good night.